There is a war going on in this country involving a plant, and we're not talking about marijuana. The kratom tree is native to Southeast Asia with leaves that contain compounds which can have mind-altering effects. Tonight we begin a KELOLAND News investigation into the substance and the politics versus science surrounding it. Angela Kennedy takes an in-depth look at how kratom supporters are rallying to keep the substance legal and their fight with the FDA.
KELOLAND Investigates previously reported that kratom is being linked to more overdose deaths from a Centers for Disease Control report. Since our story aired, we have been contacted by hundreds of people from all over the country at the prompting of the American Kratom Association, a $1.2 million lobbying group whose goal is to keep kratom legal and, they say, safe. They call themselves Kratom Warriors. They deny federal government statistics on overdose deaths caused by kratom, and they're taking on the Food and Drug Administration.
Call it a sign of the times. Since 2016, kratom use has tripled in the U.S., with more than 15 million people consuming it.
It's a $1 billion plus business in America today.
I went on the internet and I looked up natural pain relief because I don't like taking drugs.
A decade ago, Gavin Wigg decided to try kratom after experiencing severe throat pain.
It was amazing. Like, I remember it very, very strongly. I was like, oh my gosh, I don't have pain. This is wonderful.
But after his pain ended, Wigg didn't give up kratom. He still takes it several times a week, either in powder form with water or using the leaves brewed in a tea.
This is energy. This is like you think clearly. You think very focused. I just work better.
Kratom works as a stimulant on the brain at low doses, and at higher doses has an opioid effect. While Wigg says he is able to use kratom effectively and safely, there can be a darker side to this leafy plant.
Kratom isn't as benevolent, as risk-free as what's reported out there in the sales pitches that I've seen.
Psychiatrist Dr. Matt Stanley says he has treated patients for kratom addiction and withdrawal at the Avera Addiction Care Center in Sioux Falls.
This is a business of selling this drug, this kratom, and we should classify it as a drug, not an herbal supplement. It is psychoactive, and even I think the proponents of it wouldn't argue that.
I'm not suggesting that a person cannot become dependent on kratom. They can. It's like coffee. It's like caffeine.
The American Kratom Association says while several cities and 6 states have banned the sale of the substance, it's worked diligently to stop more states from doing so, including South Dakota. Carl Perry, a state representative from Aberdeen, found out what he was up against after introducing a proposed kratom ban in Pierre during the last legislative session.
The problem is they have a group that are kratom supporters that is incredible what they can do. And they send out 300 to 500 emails to everybody, and they just blast with all the good things about kratom. And the fact is that kratom is something that can kill somebody.
Following the defeat of the South Dakota bill, the American Kratom Association boasted on its website the committee members heard the voices of kratom warriors, with many committee members citing the hundreds of emails they had received from kratom consumers who touted the benefits of kratom.
We have defeated every one of those bans, and in the 6 states that are currently banned, we're working to unwind those because the FDA was wrong.
The FDA says there are no approved uses for kratom. KELOLAND Investigates looked at the data in the FDA's adverse event reporting system. Between 2014 and 2017, there were 11 reports of adverse issues involving kratom. Between March of 2018 and February of 2020, that number jumped to 42. Plus, there were nearly 2,000 calls to poison control centers between 2011 and 2017 over exposure to kratom. In an email to KELOLAND Investigates, the FDA said kratom is not legally marketed in the United States as a drug or dietary supplement.
The bottom line is the FDA is wrong when they say that there's no legal use of kratom. There is. Kratom is a food.
However, the kratom lobbying group points to limited research that kratom could potentially help people get off drugs like prescription opioids.
The promise that kratom offers in this field of opioid addictions and the number of people who are reporting to successfully reduce their consumption of dangerous and addictive opioids or to wean off of them entirely was so promising.
According to the FDA, selling unapproved kratom products with claims that they can treat opioid withdrawal and addiction and other serious medical conditions is a violation of federal law. Dr. Stanley says he sees patients trying to manage their opioid addictions with kratom, but it's not something he would recommend.
I don't know of any medical facility that is using kratom to manage withdrawal. In fact, we've had patients come into our addiction facility whose primary substance of abuse is kratom. So no, we would not use kratom to manage opioid withdrawal. We have other medications that are FDA approved and monitored that we would utilize.
The American Kratom Association says it wants standards and labeling for all kratom products sold to consumers. In the meantime, it will continue its fight with the federal government and states that try to outlaw it. Representative Perry says he plans to bring the issue back before the legislature in the 2021 session.
I have a renewed effort on this. I think kratom is something that needs to be banned in our state. I think it's not good for people, and I'm going to fight the fight.
According to the Centers for Disease Control, kratom was determined to be a cause of death for 91 people in 27 states in a year-and-a-half period ending in 2017. Most also had other drugs in their systems. The South Dakota Department of Health says 3 deaths were caused by kratom overdoses this year. Coming up tomorrow night, we hear from the family of a Sioux Falls man who died in July and why they want to issue a warning about the dangers of kratom.